This presentation is on blood, specifically the constituents or components of blood, and the functions of those components. A research study will also be reviewed on transfusions of blood and blood components. Blood's constituents have two different categories. First, the plasma. In the plasma, we have water, which is basically a transport medium that carries heat to parts of our bodies, which is what makes our blood flow. We also have electrolytes, which is fluid dispersed by osmosis between extra and intercellular fluid and is a buffer for changes in our pH in our blood. We also have nutrients, wastes, gases, and hormones, which is responsible for the carbon dioxide in our blood, which is important for acid and base balance. Our plasma proteins are also in the plasma. They have an osmotic effect exerted that is important for extracellular fluid distribution. And these proteins are also a buffer for changes in pH as well. These proteins are the albumins, which are used for transport for various substances, and they assist with osmotic pressure as well. And also our globulins, there are three different types of globulins. Our alpha and beta globulins, which are water-soluble substance transporters, and they have our clotting factors, which help our blood clot properly when we need it to, and they're precursor molecules that are inactive as well. Then we have our gamma globulins. This is where our antibodies are stored. Very, very important, these gamma globulins. Finally, we have fibrinogen, which is a precursor for a clot's fibrin meshwork, and it is inactive. The next category of blood components or constituents is cellular elements. Cellular elements compose of our erythrocytes, which are our red blood cells, and these red blood cells are how our oxygen and carbon dioxide throughout our blood gets transported to parts of the body that they need to get transported to, and primarily used for the oxygen transportation. Leukocytes, which are our white blood cells, are also in this cellular elements category. Of leukocytes or white blood cells, we have several different types. So firstly, we have the neutrophils, which are responsible for destroying bacteria, and they engulf and destroy bacteria and debris in our bloodstream and throughout our body. So they fight off bacterial infections. Eosinophils, which attack parasitic worms, so like a tapeworm that we might get in our gut. These are what would be responding to that and helping to destroy that worm, that foreign thing in our body. They also play a role in allergic reactions, so they help fight when we have an allergic reaction to something that we're allergic to. Next is the basophils, which they are responsible for the release of histamine, which probably sounds familiar because we take antihistamines like Benadryl. So they are very important when it comes to allergic reaction, these basophils. So they release histamine. Histamine is what gets released in our body when we have an allergy to something that causes us to have an anaphylaxis or a rash or itching or anything that can result from being allergic to something. Without this histamine, we wouldn't have these allergic reactions, and who knows how our body would react to something. And if we take antihistamines like Benadryl, they'll cause this release of histamine to slow down, which makes our symptoms not be as bad. Then we have heparin in the basophils. They also release heparin. So heparin is important for clearing fat from the blood. So if you have a high lipid diet that are not good lipids, so like you eat a lot of fatty foods, oils, things like that are not good for you, then your blood can fill up with this fat and it can cause you to have clots or blockages throughout your body, which can cause a lot of problems like stroke and a lot of issues. So these basophils have that heparin. Then we have monocytes. These monocytes will become true macrophages, which will go around and basically like a Pac-Man and eat the cells in our body that need to be destroyed. And then we have lymphocytes. We have B lymphocytes and T lymphocytes. B lymphocytes are responsible for antibody production. So when our body gets some certain type of virus, these antibodies are produced so that our lymphocytes, these B lymphocytes, can also, so our white blood cells can respond more efficiently the next time our body is exposed to that virus. T lymphocytes are responsible for cell-mediated immune responses, so like an immune response within our cells, so like a response to cancer, HIV, things like that. And then platelets are in the cellular elements as well, and they help with homeostasis. So they basically just help with keeping enough blood in parts of the body that we need that amount of blood. Now I'm going to discuss the research study that I reviewed. It is a cross-sectional study to analyze blood and blood component transfusion practice at a tertiary care hospital in Ethiopia. It was completed, which viewed the demand and utilization of both blood and blood components at a hospital in Ethiopia. The study period went from June 1st of 2018 to August 31st of 2018. It was at St. Paul's Hospital Millennium Medical College. Different types of data was obtained. They reviewed the types of blood products that were needed, the indication of transfusion, which means the reasons they were needing these transfusions, the patients, and then the blood products that were used and how they were used. All this information was collected, this data was collected by a structured questionnaire for the employees of these patients. So a little bit on the research results. There are several different tables and figures to go over. In table 1, you see the blood group distribution among patients for whom blood transfusion was requested. 819 patients had need for blood or blood components. The most common blood type was blood group O, RHD positive, of which 292 of that 819, which is 35.7% of those total patients that needed blood transfusions were that blood group, O, RHD positive. The second most common was blood group A, RHD positive, which had 259 patients of that 819, which is 31.7%. And as we see in the graph, we see the other blood types and the RH factors and things and the total percentages there. In this figure, you see the blood and blood component utilization by each department. So there was 3,290 units of blood and blood components requested, and then only 1,840, which is 55.5% of that 3,290, were actually transfused. So red blood cells, packed red blood cells, of that 3,290, 771, or 42% were packed red blood cells. 460 or 25% were platelets. 352 or 19% were fresh frozen plasma. 257 or 14% was whole blood. The leading utilization by the different departments were gynecology and obstetrics first, which used whole blood and packed red blood cells, 338 units in total, which is 37.7% of the total amounts that were requested. The internal medicine used platelets 231 or 50.8%. They also used FFP, which is of 128 units, which is 36.1%. Throughout this study, packed red blood cells and whole blood were used interchangeably. Table 2 shows a common diagnosis requiring whole blood or packed red blood cell transfusion on an emergency basis in the different units of obstetrics and gynecology departments. The requested blood availability, they requested 456 units, but they only got 238, which is 52.2% of what was requested in the obstetric emergency department. The leading indication in that department was postpartum hemorrhage, or PPH, which was 70 units that were requested for that, which is 29.4% of what was actually used. Secondly, severe anemia, which 66 units, or 27.7%. In the emergency gynecological conditions, 86 out of 181 were transfused, which is 47.5% of what was requested. The leading indication in that department was gestational trophoblastic disease, or GTD, which 24 of those were used, 27.9%. And then secondly, incomplete abortions, which had 20 units, which is 23.3%, which these can all be seen in that table. And there's some additional data in there as well. Table 3 shows common indications that required whole blood or packed red blood cells transfusion in the different units of Department of Pediatrics and Child Health. So this is with children, probably up until the age of 18 or 21, that needed blood transfusions. So this is the pediatrics department, which had the leading indication of blood transfusion being severe anemia or congestive heart failure, or CHF. Then they looked at the neonatal intensive care unit, or NICU, which had the indications of neonatal hyperbilirubinemia and severe anemia. The requested blood availability was 72 was transfused, 95 was requested. So 75.8% of what was requested was transfused. And that was in the pediatric ward, or OPD, and 91 out of 93 units, or 93.7%, was transfused in the NICU. Table 4 has showed the common indications for whole blood packed red blood cells during the study period in the Department of Internal Medicine. The requested blood by the Internal Medicine Department, they requested 388 units. They got 240 that were transfused, which is 61.9%, and that was in the medical ward of the Internal Medicine Department. In the adult ICU, 66 were requested, 41 were transfused, which is 62.1% of what was requested. The most common transfusion indications, so the reasons that patients needed these transfusions in the medical ward and emergency unit, were anemia and upper gastrointestinal bleeding. In the adult ICU, coagulopathy and disseminated intravascular coagulation were the reasons that were needed. And as you can see in this chart, there were other reasons as well. Lastly, we see Table 5, which is a common emergency indications that required whole blood and packed red blood cell transfusion during the study period in the Department of Surgery. So this is in the Department of Surgery. So the total blood requested on emergency time during the study was 87 units. The units of blood available versus what that were transfused were 52 units. So they requested 87, they got 52. So the availability was only 59.8%, which isn't that great. So leading indications in the Department of Surgery on an emergency basis was abdominal trauma and small bowel obstructions. And there's some other issues going on there as well that you can see in that chart. The conclusion of the study was that the most common uses of the transfusions by department and by types of things that were needed for was obstetrical emergencies, so emergencies when it came to women giving birth, before or after or during the birth, severe anemia, and then of course injuries. So that could, injuries falls into that kind of big category of different things that could have occurred. The study showed severe scarcity of blood resulting in potential patient survivability impact, which means basically that this hospital is needing more blood than they are able to produce or they are able to give to patients. So, there could be an impact in patient survival when it comes to certain types of things that are happening for these patients that they need blood transfusions. The study did suggest certain things that should be done to be able to help with this result. The hospital should collaborate with the National Blood Bank and come up with a plan to help relieve shortage. So they should try to work in getting blood drives and things like that if that's available in Ethiopia. The hospital should also implement a stronger utilization of components and have a demand reduction by different approaches for preventative measures against severe anemia and treatment of hypervolemia. So basically, especially for all the reasons, the common uses that these transfusions are being used for, these two, severe anemia and treatment of hypervolemia, were realized to be the most severe, that needed the most blood for transfusions. And they this study concluded that maybe the hospital should implement some kind of more effective utilization of transfusions, and then maybe they should be able to take preventative measures against those two types of things and maybe other types of indications of transfusion to help prevent even the need for a transfusion. And then, of course, guidelines should be composed for the use of blood and blood components. These guidelines, could be anything that would help the regulation of the use of blood transfusions. And then the blood requests and use by departments should be audited. So basically, they should do a review of the different requests that are happening in this hospital and by what departments. Are they really, is there anything they could do to prevent that need? Is there some kind of education that needs to be done for these employees. Finally, you have my references. First, I use the book and then my peer-reviewed article there throughout my presentation.